So it's really been in the last 10 to 15 years that this is now the routine care for people. And one point that I make here in my bulleted points is that almost always, if there's going to be certainly a plan for removal of any of these blood vessels, we precede surgery with chemotherapy. And this is because, well, many reasons. One is that sometimes we can actually see the tumor shrink away from the blood vessels in a way that obviates the need for this more complex work. Other times, we're looking to administer the chemotherapy beforehand in a time when people are, relatively speaking, strong, fit, and not dealing with recovery from a major surgery. So as we increase the complexity of the surgery, there is some increase in the likelihood of delays to recovery, even complications. And that can mean delays to chemotherapy. So rather than risk having chemotherapy delayed by surgical recovery, we flip the script and give the chemotherapy, in these cases, routinely beforehand. At least some of it. Not always all of it, but at least some of it will generally go before the surgery. As I mentioned, that the whole idea of this is that we actually expand surgical candidacy to a greater number of people, because we know that surgery is, again, one of the cornerstones of treatment and arguably the most effective treatment for pancreas cancer. So we want to give as many people as possible the opportunity for surgery.